Hello everyone, welcome back to my channel. If you're new here, my name's Erin. I am a fourth year urology resident, and today I'm actually gonna do a video about urology. I do a lot of videos about like the medical school experience and resident experience in general, but today I wanted to do one about urology, and this has been a topic that's been on my mind for the last couple, I would say for the last year or so, as I decided whether or not I wanted to do a fellowship, reveal at the end of this video. But I wanted to go over types of urologic fellowships because I think not a lot of people know what even urology is, let alone that you can do different fellowships within urology. And I, as a medical student, didn't really know what urology was at all until I rotated on it. So I hope this is helpful. If it is, please don't forget to subscribe. Let's jump in. So if you don't know what a fellowship is, it is a certain X number of years of training after your residency training. And the idea is to become even further subspecialized within your specialty. And a fellowship is usually something that people go to right after residency, but sometimes people do, take jobs, work in their specialty, and then go back to fellowship later. It really just depends. Some fellowships that you may know of are like gastroenterology or cardiology. So people who have done internal medicine residencies can do fellowships in those subspecialties. Orthopedics, you can do sports medicine, spine, joint. And it depends on what fellowship you do, the number of years that it is of extra training. For urology, we have a number of different fellowship options. I'll go over them and kind of go over basically kind of what you're further getting education in. So the first is Female Pelvic Medicine and Reconstructive Surgery, or FPMRS. This is usually the surgical and medical treatment of pelvic floor dysfunction, which is prolapse, incontinence, and as the name suggests, this is often more focused on the female side of things, and it's often called female urology. Endourology is another option. This is a lot of focus on more minimally invasive techniques or techniques using scopes. So things that you do are kidney stones or advanced BPH, more minimally invasive treatments. There is andrology and male fertility, and that is what it sounds like, male fertility. So a lot of, the medical treatment of male infertility, but also surgical treatment of male infertility. And then oftentimes there's a sexual medicine aspect of this where you deal with erectile dysfunction or Peyronie's disease. And that kind of brings me to the point that some of these fellowships are very straightforward in what they are treating. There's just FPMRS where you're just doing female pelvic medicine, but there's also some fellowships that are FPMRS mixed with reconstructive urology, which is another option for fellowships. It's basically lower urinary tract of the male gender too, fixing if there's urethral narrowing, any trauma, reconstructing that urinary tract. And sometimes those two types of fellowships are mashed together, and sometimes they're totally separate. And if you're doing a reconstructive urology fellowship, you're not going to do so much female, or you may. So it really depends on the program. I'm trying to speak in as broad terms as possible, but every fellowship is unique, obviously. Okay, back to the types of fellowships. So we went over reconstructive urology, and then sometimes there's a trauma component of this. So how to treat traumatic urologic injuries, or the sequelae of traumatic urologic injuries, because often traumatic urologic injuries come with, down the line, you need to reconstruct the urinary tract if it becomes disrupted. Pediatric urology, urology in kids. You may be oh, isn't that just smaller adults? No, there's an entirely different set of pathologies that you deal with, a lot of genetic pathologies that come along with it, a lot of pathologies that are fixed when people are kids and that adult urologists don't deal with as much. So that's its own subspecial or own fellowship. Urologic oncology, which is urologic cancer, so bladder, kidney, prostate. And then there's another type of specialty, which is robotic, laparoscopic, and minimally invasive surgery. And this, you'll focus on the surgeries that we do that are laparoscopic and robotic. There's some overlap of this with oncology because a lot of the oncology cases that we do are robotic, but it is a separate fellowship. So one thing to think of when you're thinking of fellowships is that some are accredited and some are not accredited. And accreditation is given through the ACGME, which is the Accreditation Council for Graduate Medical Education. And it's given when a program, and I read this off the website and I'm reading it off of my thing, it's given when a program meets certain standards for education. This does not mean that the fellowships that are not accredited are not as good. They just haven't given to, like, they haven't gone through the process of getting accredited yet, and accreditation is not given to every type of subspecialty fellowship. There are certain fellowships that they have like accreditation standards for and some that they haven't even written standards for. So some types of fellowships can't even be accredited. But sometimes I feel like people think that non-accredited fellowships are not as good, and that's not necessarily the case at all. I believe that the only ACGME accredited urology fellowship subspecialties are FPMRS and pediatrics. And this means that you are like board certified in that specialty and you take like a separate set of boards. None of the other urologic fellowships, you do that. And I don't know why that is, to be honest with you, I'm not sure. There are other fellowships that are endorsed by certain societies. So there's like a Society of Urologic Oncology, and that Society of Urologic Oncology will endorse different urologic fellowships, and that's another way that they are like validated basically. A lot of these fellowships you go through a match to match into, so it's similar to residency match, and oftentimes the match is through these societies. So like the Society of Urologic Oncology will do its own match for these urologic oncologic fellowships. There are fellowship positions outside of the match, so this is oftentimes a less formal process. I mean, they will still hold interviews, or it's by word of mouth, or it's through networking. It really, again, depends on the program. But there are some fellowships that you don't necessarily need to go through a formal match with a match date and rank list and everything to match into. Okay, so those are kind of the nuts and bolts of the urologic fellowships. Now I'm going to kind of go over what I considered for fellowship throughout my career and what I ultimately decided. So when I started residency, I was pretty sure I was gonna do a fellowship. I feel like you're kind of holding yourself to this standard and you always wanna hit like the next best thing, the next best thing, the next best thing, and for me that was fellowship. In terms of what fellowship, I knew I really liked open cases. I hadn't had so much experience with the robot, but I just always loved having like hands-on. That's why I went into surgeries, to do like small hands-on delicate surgery. I just have always really loved that. I love suturing, which everyone's like, what? But I just love that like delicate motion to make things look pretty, and I just really like that. So originally I was considering reconstructive urology. Like I mentioned, that is kind of putting the lower urinary system back together. Making it right, like fixing any problem that it has, whether it be a stricture of the urethra, a fistula. You know, you can do a lot of implants in that fellowship, and I also love to do implants, and so that was really what I was leaning towards. Then my third year, I did an infertility rotation, and part of why I really liked reconstructive urology, like I mentioned, is implants. That's one of the reasons I honestly went into urology. I just love them. And infertility, you have that sexual health component, which I've always been really interested in. And I think it goes together well with an interest in social media. I think it is a under talked about aspect of urology and of health that is very marketable and that is very interesting to the public and applicable to the public. So it goes along well with media. I loved the delicate surgery in infertility. You do surgery literally looking through a microscope a lot of the time, which I think is fascinating. It's part of the reason I really love peds too, wearing loops. And I really, this is so weird, but the HPA axis, which is like the hypothalamic pituitary axis, is very interesting to me. And I think that it makes a lot of sense medically, and that infertility specialty deals a lot of hormone imbalances, which I think is very interesting. So I was like, oh, perfect, I'm gonna do infertility. This is so easy. It's also a one-year fellowship, which is what I was interested in. kind of like I alluded to, but then I did pediatrics after I did that, and I also loved pediatrics. Again, it's this small, delicate surgery. The planes are beautiful. You're doing a lot of open cases. You get to be around kids, which is great. It is a 2-year fellowship, and I was not so sure I wanted to do that, and that's kind of why I ended up not picking peds. And I was really kind of agonizing over what fellowship to do, and then I was like, what if I just don't do a fellowship? Because I know that I want to stay in the area that I'm living in right now. I love infertility, but I also love general urology. General urology, you can do a little bit of everything. I feel very comfortable doing prosthetics coming out of residency. I did a lot in residency, and I have really kind of made that a known interest and gotten to do like special opportunities, training classes, everything like that, which has been amazing. I love doing stones. I love doing BPH. Like, I love dabbling in everything and being kind of the first stop. And then if I don't feel comfortable doing something, like obviously bigger oncologic cases, I can refer that to more subspecialized surgeons. And general urologists are in demand. You know, a lot of people are doing fellowships, and that is obviously really needed, but general urologists are very much in demand. And so I ultimately decided not to do a fellowship, and I feel very happy in that decision. It was kind of a hard decision going from someone who always thought I would do a fellowship to accepting that, you know what, maybe that isn't the right option for me. But I can always go back and do one if I decide, hey, general urology is not for me. I highly doubt that will happen, because I think general urology is what we get a lot of practice in throughout residency. And I just know myself, and I know that I like that surgery, and I know that I like talking about those clinic scenarios with patients. And so yeah, I'm very excited about my decision. I'm applying to jobs right now, so I'll keep you guys updated. And that's kind of my journey. I hope this was helpful. I hope the thought process was helpful for you. Let me know if you have any questions. I'll see you guys next time. Bye.